Okay, we're
People are
done.
missing.
Who else is missing?
I think we are there. We are 11, aren't we? Without
In
you,
the group,
Dr.
in the
Ronak.
WhatsApp group, we are 17.
No, 17 we're not.
Sorry?
We
Did
are
you
11 without you. With you, we are 12.
Okay.
So as I see the...
Do we have everyone or?
Yes, everyone
Yes.
is here. We are 11, yes.
So, yes, I think.
Yes, we are all here, Dr. Ronak.
Yes, I guess now we are 12. So
With you, yes.
yeah. So that makes it even. Yes. That's what I was wondering. You said 11 and I said, okay.
Yeah,
It's
I
12,
said
not
11. I said 11 without you.
Okay. All right. Okay. Fine. Great. So it's good to see you, everyone. We have met last few weeks. Some of you, yeah, many of you we have met for your personal consultations with some, and some for the client consultation. And it's been such a pleasure to help you. Learning more and more, and hopefully it will help you become a better practitioner. So many wonderful clients that I have seen. It was amazing with all of you. Different stories, different people, from different places. That was great. Yeah, Radu with some of his clients, some of the very polite and humble, as well as best, as he said, because they follow everything what he says. Yes, that was good. Yeah.
Try.
Yes, and then that was one case in particular with a kid. That was really nice. Yes, amazing.
Yeah. The kid is
Good. Yes.
he started to speak a little bit. I mean, not to speak, but to try to speak. He started to try to imitate what you try to say.
Wow.
It's the
Now
first time.
that's an amazing story. Radu, before I start, I would like to request you to actually start sharing the story. Before I start sharing my own case, it would be wonderful. I guess everybody would love to hear the story.
Sure, yes.
All right. So it's a family, a young family. They have a kid. It's now 5 years old, and the kid was diagnosed at birth. He was birthed at 6th month, and he was diagnosed with what is called I don't remember now. It was ring
13 chromosome
13
ring.
chromosome ring.
Yeah, or circle.
13
Yeah.
circular chromosome.
Yeah.
You could just when I didn't know this title of diagnosis, but it looks pretty much like autism or close to autism. And anyway, the kid was developing slowly better, not because of what I was doing, because the parents were struggling for 5 years. And when we met, the kid was very angry, and he didn't like to be touched by anyone, and he was jumping from one place to another, and very not cooperative person, I would say. And slowly, I was trying to do something. He was jumping immediately. He was pushing me around, and at some point I was asking Dr. Ronak what I could do, and Dr. Ronak said, "You just call his name, and try to speak with him in a gentle manner." I was trying more and more after that to do that, and to call his name and to try to speak with him about what I see him to be interested in. For example, he keep something in his hand, and I was trying to speak with him about what he has in his hand and stuff like that. I was trying to follow his interest, and slowly he led me to do the marmas for this kind of problem that he has. And the last one, after we met with Dr. Ronak, I was doing the marma for the speech, which is a marma. You have to do something below the chin, and he was before he was very reluctant. He didn't let anyone to touch him. Now he just stay like that, and as he was listening to the cat, one of his cat toys, the cat was purring, and as he was listening to the cat, like doing like grr, grr, and I was looking to him, and I was just grab under the chin, and I said, grr, grr, grr. And he tried to speak like after, just to imitate me, which was a very, very let's say new situation, because he didn't do this before. But now he was just looking into my eyes and trying to imitate me, which is a kind of a like very big victory with this kid. And next will be more, probably, because each time seems to be a little bit more than before. So yeah, this is the probably one of the very small things that he speak, let's say, because he didn't say, just few things he say, and in the rest he just shout and nothing else. But now he start to communicate a little bit. So yeah, this is pretty much what I wanted to say.
Thank you, Radu. That's such a powerful story. Right. Thank you very much.
Thank you very much, Dr.
Thank you. Right. So the kid, as he said, he has a special condition, which is, the 13 chromosome circle or the ring, which is a very special condition and not very common, fancy diagnosis, as we call it, and which is similar to autism. His symptoms, like the parents told me that he could not speak much, very violent, always hyper and aggressive, and he would break the things, and doesn't know how to communicate. He would eat sometimes he did not even eat, isn't it, Radu? Right? Sometimes he would go for days without eating.
It was very interesting. Sometime I just arrived at their home, and this was the first moment when he agreed to eat on that day after I coming there. So yeah, it happened.
Amazing. Yeah, amazing. So for a few days he would not even eat.
Yeah.
The parents really had a hard time giving him medications. Absolutely. The herbs you forget about the herbs, even the medications from the doctors. And the herbs, they, slowly they tried with Sumeda syrup. He wouldn't even take the syrup, I guess. Yeah. So
Yeah.
they tried putting it into the belly button, and slowly, this is what happened, right? Sometimes you just have to be persistent. You can't lose your hope. You just have to be persistent. And that's all that matters. Even the smallest of victories can be big. I remember the words that you texted me the other day, and it felt like a big lottery. That's what he said, isn't it? Yeah.
Like I won the lottery. Yeah.
because because he would never ever cooperate. He wouldn't even let him do the marmas. Yeah, you just have to be persistent, and that's it. Sometimes that's all that matters. Yeah. And it's something that has to do with the genes. It's a chromosome disorder. It's a genetic disorder. It's not even a infection or something. The baby was born with it. He was born with it, and he has been like this for 5-6 years. So to see even the smallest of change, it is big for the parents. It's always big for the parents. It's amazing to see. We have helped so many people with autism. I don't know if you were there on one of the calls where Fatima shared about his son. Some of you were there, I guess, when we did the 100 days. Fatima from Canada, she shared about us, her son's autism, isn't it? Yes, just within a few months, such an amazing, powerful story. Yeah, great. So, any of you would like to ask any question, or shall we go further about the case that Radu explained?
Yes, I have one question. One
Yeah.
question, if this is the moment to ask,
Yeah, sure.
especially about the cases that we had when we had our clients with you. And this is just a general question. This is not concerning particular person, but since insomnia and difficulties in sleeping is a quite common problem, sometimes you recommended Niramai to give like in the morning and in the evening, and sometimes just resting like from 3 to 5 at night. Why is it this way? How do you
differentiate?
How do you explain the difference?
All right, so resting is something that helps with the quality of sleep, right? For people who let's say don't have a great sleep, but for people who have trouble falling into the sleep, something like Brain 2 or Nirmai can help. People who have trouble falling into sleep is mostly because of the vata going up in the head. Yeah, and they tend to think a lot, and because of that thinking, it's a trouble for them to pacify, and that's how they can't get the sleep. And that's when Nirmai or Brain 2 can help, because Nirmai has ashwagandha.
Okay, thank you.
Nirmai has ashwagandha to it. So it helps with the Majja Dhatu. So what happens is Vata creates the emptiness in the head. the lightness or the emptiness, which is why it's normally trouble getting into the sleep. So when you give ghee, the massage with the ghee, or the home remedy that I sometimes give with the almond milk and the nutmeg and the other stuff, right? That is something that can help fill the void. So you need just a little bit of, let's say, the heaviness or the oiliness quality of kapha, particularly those two things that can help cover the vata.
So the rest is more for the quality. The person
Resting
could
is,
sleep,
yeah,
but the quality of sleep, it's not enough.
yeah, right. If someone has trouble falling into the sleep, the better choice is nirmai or brain 2 or something like that.
Thank you.
Right, and when both are an issue, you can give it together, restin and nirmai. Someone who has not long hours but short hours, let's say 4 hours, 5 hours, you give both.
I also have another question, if you may. When there is tinnitus as like ringing ears, that's a vata thing, right?
Also,
But
yes,
also, but which subdosha is then involved?
subdosha, or you are asking about the dhatu?
No, I mean the subdosha. Is it?
So tell me, this area, the location is which
Yeah, it's up.
dosha?
Well, which dosha? I think it's vata. Vata is the problem.
Yes,
But
but
is it like up, moving
out of
up,
the
or
five, out of
Yeah.
the five, which one?
prana?
What is the
Prana then.
location?
Prana.
Yes,
Yeah.
yes, yes. So you close, yeah, right? Always it's the apana vayu, which is let's say the miscreant or the naughtiest, right?
Mm.
Which is the most mobile, along with Vyanavata, of course.
Mm.
But apana is always down in the pelvis, but it goes up, and then it takes several others along with it at times.
Okay.
Right? So it is basically a pranavaya location, right? But it can be apana and prana both, and which is why anulom is something that works at times with tinnitus, because you want vayu to move down rather than going up.
Yes. Yes.
Yeah.
But I was also thinking about udana. Why isn't that involved? Because that is
As I
going
said,
up.
several things, several doshas,
Yeah.
sub-doshas at the same time,
right.
because apana moves up and it takes several others at the same time,
Okay.
right? So
Yes.
you still have to see whether it's because of the three small little bones, which is making the sound, or is it more from the cochlea or the inner ear?
Okay. I guess maybe perhaps too in detail, but anyway, yes.
Yes.
Trying to understand that because of the movement, like
Mhm.
different subdoshas, like udana is going upwards,
I understand. So
apana should go downwards, and vyana is going all over. And
if it helps to begin with, if you concentrate on everything at once, it can be a little bit confusing. Just remember the location, and it becomes easier. So even if you treat the location wise, that becomes easier.
Yeah. Okay. Good.
Yeah.
Thank you.
Perfect. All righty.
Can I have a question, please?
Sure. Why not?
Thank you.
Yes,
Just
Pilar.
yes, you touched me when you said that you have to be persistent and not lose hope, okay, about the Radu case. But my question is a little bit more general, because what happened when the characteristics of your clients, like mine, that are Spanish character, and the Spanish character is not very persistent. And then they go to the consultant and go to the Zoom with you. As you know, I got a lot of cases with you, but just a few really follows the indications. What should we do? We should to be persistent and call them again and again, or we have to respect their decision is if they don't want to contact you anymore, or maybe they just started but they don't follow, or it's not very clear for me what is the best thing to do in cases like that, because with some I feel like I don't have to contact them because I will be like invading their
Which is true. Which is true.
Because sometimes you need time to in your mind to
That's a
to
good
create.
question, right?
Yeah,
So
and sometimes people need a little bit pushing a little bit and to push them a little bit more. And it's quite difficult, isn't it?
It is. So just try to understand the Vata Pitta Kapha, and you'll come to know that the Pitta people, if you remember the example that Dr. Steve gave once about 3 different people at the airport.
Ah, yeah.
Right?
Yeah.
So the Pitta
it's very
ones,
good. Very good one. The kapha goes to the ice cream. Yeah.
Yes, so they are the ones who need a little bit more pushing. The kapha ones are the ones they need a little bit more pushing, right? And the Vata ones need a bit of pampering.
Vata a little bit of space, isn't it?
Yes, right? And Pitta ones, they don't like to be told what you need to do.
No,
so,
they get angry.
Absolutely, yeah.
Yes,
absolutely.
Yeah, exactly,
So
exactly.
Sometimes you have to, respect the privacy, right? As a healer, we can only inspire and motivate. That's what we do, right? We don't push. We never push.
Yeah,
we can only help. We can only help
in,
those who want to be helped.
Right? Yeah, but the case is that some people, I feel like if I will be there, like a mother, telling them and calling them and follow them, maybe they will do it. But I don't think it's a perfect role for us, even because you cannot be all the time follow them and inspire them to have you taken the tablets, why you don't start now, why you know, and probably if I do that, I know that I can't inspire them. But
but that is also good. That is also a good idea. If with those clients, you have to have that kind of a relationship, right? If you have that kind of a relationship or a rapport, right, where you show the empathy, right, where you do show that you care about them, then you can ask about that. Nadia, would you like to share how we work with you, me? How do I work with you? Would you like to share the example?
With me?
with you because you are you are one of the people that I've been working with for some
Yes.
time.
Yeah.
I do have other people, Jaina, this Cornelia. There are many from the Path group,
Yeah,
but
yeah.
you are the one who is in the group, right?
Yeah.
So would you like to share how we keep in touch, how we do it, how I do it normally? Do I invade your
Right.
privacy at any time? Do you feel like that?
No. Actually, I'm very happy that we have this so good contact, I would say. So we keep in touch through WhatsApp with Dr. Norak. I ask him anything in any time of the day. To say the truth, and of course I'm asking him sometimes if I'm driving him crazy or not, but until now it was fine, and this is the way we do it actually. But I want to say something to Pilar about her question, because I had someone who was a bit quite difficult. Dr. Nora, you remember the last girl from Greece?
Tina?
Yes. Yes, she was very difficult at the beginning. You remember that she was, oh my God, I have to cut this out and that and whatever. She didn't really like it because she's from Greece. So you can imagine that the food, that's a big difference from what she has to have for her treatment. And I really had to message her every day. And but I could see that she wanted to. I mean, she needed that pushing. She needed me to help her out, and even to shop some stuff for her. It went also this way because she didn't know where to go, what to buy, where to find stuff. So I did that as well.
Thank you. Yes.
And so the thing is, you can see, you can understand and see if the person really wants to do that. So let's say if she is on WhatsApp or if you message each other, which we did, and she answers back and she asks questions and all this, that means she's interested to do it. She just needs somebody there to push her. But if somebody stops answering back, so then you will get the point then, no, that person don't want to do that.
Exactly.
I think that's it. I mean, you do it until a point. I mean, you send a message once, second time, and you see, third time, that's it. It doesn't take me. So that person don't want any help from me. That's what I think.
That's a great way of explaining, Nadia.
Yeah,
right?
Thank you.
So, as I said, that's how we can be. You have to be subtle as a healer, right? You have to be really subtle. Yeah. Would you like to share your study, Nusratji? How we go about it?
Sure. The first time I wasn't ready about it. I didn't know how we were going to proceed. And thanks to your recommendations, I got in touch directly with two of my clients. I tried to discuss with them, fill out the form to know which dosha was, her constitution, her prakriti, and understand what was going on. And I was lucky enough to be able to take their pulse before the consultations. And I wrote down what I was feeling, and I talked to Dr. Ronak after the consultations, and he confirmed that what I was feeling was going in the right direction. But I really wish we had our mentors next to us when we did the pulse reading, so you could, help us more understand the different pulses and how we feel them, but it's getting there slowly. And so one of the clients, who is one of my best friends, is a very Vata person, very stressed because she does a lot of things, saving the tigers in India, for example, the lions. She travels all over the world. She's done a lot of amazing things. And I think with age, she's my age now, very stressed, very Vata. And I thought it was a good idea that she would get in touch with Dr. Ronak. So I'm going to follow her, do a little bit of, the Mung diet, get her the herbs. The other client was more about when she saw my state of health. She said, oh my God, I don't want to end this way. So do you think I can do the pulse consultation? I said, we can try and get an appointment with Dr. Ronak. So it was more about prevention for her. And some of the things that Dr. Ronak saw was like low energy, maybe a burnout coming, which I wasn't able to fathom or understand. But yeah, I could understand that she was more Vata Pitta, and we have to calm her Pitta down a bit. So after the consultation, she wrote to me and saying, oh, I didn't want to, all these remedies and all this diet, and I just want prevention. So I wrote to her, I'm meeting her next week, and I will explain to her that it's not forcing her to do things that she doesn't want to. But since her big query, her big question was prevention, if she wants to prevent osteoarthritis, osteoporosis, or the burnout with low energy, then maybe these are the right steps to take. So I have to be very prudent how I talk to her and explain to her. And then depending on how she reacts, I'll take it from there.
Great. Thank you. Thank you.
Thank you.
Right. So that is how it is normally, right? Sometimes you have to respect the privacy for some people, right? And the other times, yes, where you feel you can really help that one person. You yourself, Pilar, has gone extra miles to help other people, right? The diet chart that I gave you, you took enormous amount of work to translate everything, and then you made a chart with the Spanish menus, isn't it?
Mhm.
So yes, that's the way we go forward, I guess. That's
Yeah,
what
but
I do.
it's
I
a
don't
bit
know about
this.
others. I don't know about others, but that's what I do, right? I do it with my patients. I've been working with Nadia, so from time to time I put her a message. How are you keeping up, Nadia? I put a message to Nusrat. I put a message to, other people. So many people that I've been working with. I put a message. I've been working with thousands of people, right? So I don't put a message maybe every day, but I do see to it that I, somehow put a message to the people, at some weeks or months, after some months. That's what I do now.
May I say something to that?
Yes.
Yeah, sorry.
Yeah, exactly. That's very nice what Dr. Norek does. Let's say 2 or 3 weeks, maybe if he doesn't hear nothing from me, I will get a message from Dr. Ronak, and that's very nice because it means he has you back, he's thinking about you. How is this girl doing? Is she fine? Is she not fine? And it makes you feel good. That even your doctor is there for you. And I think that's something we should have also in mind. And if we have our own patient, we should do that as well.
Thank you, Nadia. Yes. Right. That's what I would maybe advise everyone.
Yeah.
Right. I wouldn't say that everybody has to be, following the same thing that I do, but that's what I've learned from some of my masters. And that helps me. believe me, it helps me, because then people, you know, just a message or a mail or something, and the person feels that, you know, I care. Yes. And
I
that
just
becomes
wanted to-
very important. When you are doing a remote thing, it becomes really important.
I just wanted to add that it is very important that we don't pressure the people, but a little message once in a while, I think it makes everybody feel special, that they're not alone and that we haven't forgotten about them. For example, when I had the clinic in November, January, I made a call or I sent a message to about 50 of the people who would come. And one of them was really happy and said, oh, when are the doctors coming again? You know, I'd like to see them. And so I said, well, for the moment, it's not possible, but I have, you know, I'm doing my course of the 3 years and we have these special consultations. So she said, oh, I would love to have one. And she was so enchanted with Dr. Ronak. So she wants a mom and her daughter to have a consultation. So maybe during March, we'll try and figure it out. But I think a little word or a little message or just keep track of the people, it's very important. I mean, it makes me feel good when people think of me. So I'm sure they feel the same way as well. And thank you, Dr. Ronak, for always taking care and asking how we work. Thank you.
For me, it's not only about my patients, it's also about me, because every time when they say, you know, oh, I'm doing good, I feel better. You know, it makes me happy to see the progress of the people. And yeah, that's why I do it. I keep doing it.
I want to share with of you that the important thing of showing love and care, I think, is I'm gonna arrange a Zoom call with you from March from a patient that has cancer. She had a chemotherapy, and she was like reacting very, very badly with diarrhea and everything, and she was terrible. And she's it's a family of a friend of mine, and then the family said call her, and then she called me and we were talking, and I know her previously, obviously, but just talking, the first day we were talking, the voice was like a no voice, because the all her energy through the diarrhea, the ojas were running away.
Right.
Then the voice was very, very thin and very low energy. And after talking, I called her second time, few days, 4 days, and she was completely different. Why?
Fantastic.
Because she felt like she was cared of, and for someone she feel like had the possibilities, because I was talking about you, about Ayush Shakti, and about my therapy, energy therapy, and things. And she felt like it, and even called to my friend, and my friend called me, what have done with my cousin? But
Yes.
she's completely different. I say, yes, I notice it. And now she's coming from another province. He's coming here to stay in my house for 7 days.
Wow.
And the only problem, I would like to go, that she would go to Dr. Herman, because Dr. Herman is going to be here.
Pulse reading, yes, absolutely.
I'm going to try to do it, but I'm not, because she said that she don't feel like to go and travel there and I'm waiting there, that she prefers doing Zoom consultation. I know it's different, because now that we got the Dr. Herman there, it will be perfect. But probably
maybe in future, who knows, maybe in future, maybe April or
Maybe
May.
from the first day she's coming, because it's 7 days, maybe we can
Yes.
change her mind.
Yes,
But
exactly.
yeah, it's incredible. Believe me, it's incredible. In 4 days, doing nothing, just talking to her on the phone and just sending her and her WhatsApp after the first call was, thank you very much. I feel your love and your care, and then that is what I need.
And that's
It
the
may
quality
shock
of a
me.
great healer,
It's
right?
what I
That's all you
need.
have. Yes, the
And I said,
positive
my
energy,
goodness,
the
a person
positive
who
energy
is
that you give.
exactly,
Yes.
it's incredible. In 4 days, she was different, doing nothing. Just she felt she was loved and she had hope. And someone that she trusts was in charge with her, and completely different. The energy and the urges, and now she's wants to drive 7 hours to come here. It's
Great.
incredible, incredible. Then it's true what you say, and all of you know that. I think it's the half of the therapy is that the person feel loved and feel there is someone is taking care of that person,
Yes.
that is value, has value, you know. But when you are ill, you feel like you value nothing, and when someone show you that you value, you are incredible, no? And you are
Yes.
we want to give you love, and the change is completely different.
That's
Yeah.
why we say we love you and we are with you. Isn't it?
Yes. Yes, and the sentence of I didn't come to teach you. I say as well, and to heal you. I didn't come to heal you, but I come to love you. Yeah, yeah, of course.
Exactly. Right.
But
So that's
I
what they
want to,
need.
yeah, but I want to just to share. Sorry to keep so much time, but for me it's a bit discouraged. Se dice así, descorazonador, Elsa. Disencourage. How do you say? Descorazonador.
Discouraging.
Yes, discouraging.
Mm.
Thank you,
Yeah.
Dr. Rona. Your Spanish is
Poquito.
so good.
Poquito.
When you put that such much love, effort, and everything, and the person just do nothing. You know what I mean?
I understand completely.
I've
Yes.
got several clients with you, Dr. Rona, that they,
I understand,
you
but
know, that
that's
they
how people
disappear.
are. You have to respect their choices, right?
Yeah.
Sometimes you just have to respect their choices. You can always, pull them back in at times, but somebody who doesn't want to be helped sometimes, you can't force them to do that,
Yeah.
right?
I think some people, many people wants the idea in her mind that something is going to be very quick, and as soon as they try 1 month or 2 months and they don't see any results, remarkable results, then just go down, and they don't want to follow all the discipline of the tablets and the diet and
Yes.
etc. And it's a pity, because you see that in front of your eyes and you say, God, why you don't put a little bit more
Exactly.
effort, no?
Right. So today I was going to share with you guys a different case, but just because this came up, the persistence, right? What is the value of persistence? What is it that you need to get the results? I'm going to share with you one of the cases that I have treated, right? And I've been treating him for about 9 years now.
Wow.
9 years. Yes. Ever since, so I would like to tell you a story about Adrian Christie, one of my clients. Adrian Christie was born in Canada, and when he was born, he had a special condition. He was born with colitis. He had small bit of hole in his intestine. So the doctors had to do a surgery. They had to cut his intestines and remove a small part of the intestines, and they did the anastomosis. That's the medical word when you do a surgery of the colon. So they did a small surgery. They removed a bit of a part and they put it together. At the age of 21 days, right? What came after that was, I guess, about 3 months or 4 months. When he was 3 months or 4 months, he started vomiting, and his tummy grew bigger and bigger and bigger. Right? The doctors did all the tests, everything from CT scans to the ultrasounds to the blood tests and everything, and they came to a conclusion that the boy actually had a liver disease. He was born with a genetic liver disease that they felt they could not cure. Adrian was the solo child born to the Indian parents living in Canada, right? So Nusrat ji probably can understand what it means, and so the parents were really terrified to know that, and the doctors said actually that the boy only had a month or two, to live, and he wouldn't probably make it. So rather you go to your native country, you go to India, and you live among your friends and families. Probably it would do some good to him, and that is how Mr. and Mrs. Christie, they came back to India, probably in the year of 2012. So almost 10 years now. 2012, they came back to India, and somehow they came to know about Ayushakti from one of the relatives from Canada. They had heard about Dr. Naram. So they Googled it, and somehow they got the address to one of the clinics where I used to practice. And the mother actually emailed me. She spoke to me, and then I told her to email me all the reports. She emailed me all her reports to begin with. I went through all the reports, and then I said, yes, we can do this. They brought the boy. Probably he was around 4 to 6 months when he had come. He was just a little boy, with a big tummy and small pair of hands and feet when he came. We started with the herbal supplements. I told them practically to give only and only goat milk, nothing else. And the parents were like, how do I get the goat milk? Where do I find the goat milk? What I'm gonna do, because the doctors say, he's not gonna make it past 1 month or a couple of months to top it. That's how skeptical the parents were. But they followed all the herbal supplements, even the tablets that we have. They crushed them and gave it with goat milk. The father went, few kilometers to go get the goat milk for the kid. Slowly but steadily, he could make it to his first birthday, and the parents were overjoyed with that. from time to time, we used to do all the ultrasounds and the blood work, and the things became better and better and better. You know, not to say that there were no glitches in between. It's like a relay race. That's what Dr. Naram used to say. It's a relay race. So you have obstacle race and relay race. So you have obstacles in between your path, right? And the job of the healer is to hold the hands of the client to get, you know, past the obstacles. That's what we as a healer, we had to do. The boy would vomit, you know, with blood, and also the, what do you call it, a little bit of cough, the phlegm. Let me show you a picture of the kid, how he looked. So maybe you can better relate to him then. This, yeah. So Adrian, at the age of probably 20 days, this is how he looked like. Right? Incredible. Yeah. What they can do to a 21-day baby. Right? And post surgery, he would look like this. After the surgery with the colon thing that he had, colitis. And this was taken in Canada. So the surgery he went was in Canada, as I said. When he started with the goat milk, he was a 1-year child, and the mother would come and, can I start with some other food? I said, no, just the goat milk, nothing else. But then what will happen to my kid? Because he wouldn't grow. I want him to grow. I want him to give, you know, a chicken or an egg or something. I said, no, we want the liver to heal, right? So we practically gave him goat milk maybe for 3 years.
Oh.
Yeah, 3 years and nothing else, just goat milk. We introduced maybe just a little bit of moong dal and some veggies, some fruits when he became 2, but nothing else. You know, slowly but steadily, the fluid, the ascites that he had, the fluid that he had in the tummy reduced. You know, he would vomit, like I said, sometimes with the blood. That happened a couple of times. They went to a wedding, and he would eat that stuff that he wasn't supposed to, and this is what would happen. This is what it would look like. Terrible. A 2-3-year-old, you know, doing this. Parents were so shocked to see all this. They had all the doubts in their minds, because the medical science said that the boy wouldn't, you know, live at all. It was an age where they couldn't even do the liver transplant. Maybe if he grows old, they would think about doing a liver transplant, not at such a tender age. So still that they persisted, they continued with all the herbal supplements that I gave, Livtone, Toxigo, Virachan. You know, we gave Immuno, we did Suniram, we did Pitashamak, we also did Rejuliv, you know, we also did Gas Mukti, because the boy had a lot of gases in the bowel. We also did ayurseed, to cool down the pitta. As this is more of a liver thing, he produced excess amount of bile or the pitta. His blood work always used to show the bilirubin levels were high. Slowly, everything worked out really well. Right at the age of 3, when we did another ultrasound, his liver wasn't enlarged, and it was how it is supposed to be at that age, right? And then slowly we introduced more food, rice, some more veggies, the millets, some more complex stuff, right? Few more complex stuff.
Dr. Ronak,
Mhm.
please, you said good milk or goat
Goat.
milk?
Goat
Goat
milk.
milk. Yes,
Goat
okay.
milk.
Just to be sure, thank you.
Yeah,
Then-
goat milk.
Then goat milk is not heavy. It's not
No.
heavy to digest. I
No,
always thought that it's very heavy to digest. no.
goat milk is not heavy to digest. Goat milk has one of the best qualities that helps you repair the liver.
Wow.
It has
Because
some kind of immunoglobulins that helps
Wow.
you remove the autoimmune liver disorder.
Wow. Because I've got close to mine, I've got a family that has 400 goats, and I can't get all goat milk. I can't. But I
Great.
never drink it because I thought was diary and it was heavy to digest, and for me
It
it's not
is.
good.
It is, but for people with liver condition, it helps to eliminate pitta. It helps to get the excess amount of water to, so he
For backup
never
pitta, like
he
me,
never
no.
needed aspiration of the fluid. We didn't have to remove the fluid from his tummy, Yes, Nusraji.
I was just thinking about someone I know who had a liver transplant and who isn't doing too well, no appetite, losing a lot of weight. Could we advise him to start having a little bit of goat milk?
Yeah, organic goat milk, something
Okay.
like that. You just have to make sure that the goats were never given the antibiotics and blah blah blah.
Yeah. Okay.
That's something you have to make sure. Yeah. Right.
Thank you.
But for example, it will be good for me to drink goat milk.
Mhm. If you're not allergic to the dairy or the lactose, right?
No, but I'm not allergic, but milk, I hate always, all my life, I hate milk, and the dairy makes me constipation, give me constipation. I don't know if goat milk
Then
will change that.
I doubt, but you have to try. You can try, and then only you will come to know. Right?
Okay,
All
I will
right. So
try.
yeah.
And,
Sure.
and even cheese, goat cheese made with that, because that is pure. I see the guy. I don't know how do you say when you take the milk from the goat. I
The
see with my
shepherd.
eyes, and
The
I take it from
shepherd.
there to my house. It's so pure, and it's so.
Well, you can try then. You can try, but
Okay.
just don't forget to warm it up. Just boil it first and then have
Yeah.
it.
Yeah.
So this
Okay.
is Adrian when he was 8-year-old,
Wow.
right, doing his prayer
Look at
in
that.
the church. Look at that. Yeah. A handsome hunk.
Wow.
So he's still doing all the supplements. He's still taking it. I'll show you a video where her mother is telling the story.
Congratulations, Dr. Ronak. My goodness, such a miracle.
Yeah, it was a miracle. The parents couldn't believe it, especially after what the doctors had told them. You know, it's in Hindi, but you can see the subtitles. Maybe Nusratji can understand. Are you able to follow what she's saying? She's saying that, the tummy was so big, it felt like a balloon, filled with water. And then if you pinch the tummy or if you tap it, you could almost feel as if the water was moving.
Mm.
'His platelets were very less. This is one of the complications from liver. He always had very, very less platelets to begin with. Now it's all good, but this is one of the reasons why there was bleeding at times, even with the vomit or the cough that he had. Sometimes there was a little bit of occult blood, some blood, even with stool to begin with. Five years actually. So not even 3, it was 5 years. Sorry. He's completely normal. Because I mean, as a mother, she was very cautious. She got admission for the son 1 year later. So but he's still good with all the academics. He's at par with all the children. He gets good grades. He doesn't have any problems focusing or anything like that. He's good. So there is no ascites. That's what she says. We did from time to time all the reports, and he's completely normal, but he still takes it, right? Of course, he's growing now. He understands it, that he is on a special diet. He doesn't have to eat wheat or not the regular milk. And there are other stuff that he cannot enjoy, like a burger or pizza. But mother actually goes extra miles to prepare a vegan, pizza or something like that, because they live in a remote town, which is countryside. It's difficult to get, all that stuff, the fancy vegan pizzas and vegan cheese and gluten-free pizzas and stuff like that. You can't get it in the countryside. They are from a countryside. This video was taken probably 3 years or 4 years back. The boy now is around 12 years of age. And he's going to be coming on 10th of March to meet me. They live almost 400 kilometers away from Mumbai. And they come to see me once a year or something now. Unfortunately, the mother, she's no more. The mother actually, they lost her to some meningitis or something. Something happened with the brain. I don't know what happened, but it was pretty quick. And yeah, so I texted as usual, just to see how she's doing and all. And the husband replied that this is what happened. And then they were like, could you have helped? And I said, I don't know. Because I don't know the reports. I don't know what happened. I just understood what he said. This is what happened. Okay. Right. So persistence. 12 years. 12 years. Right. A genetic disorder, which the doctors in Canada refused. They said 1 month. While shooting this video, the mother, when she said, the kid won't live more than a month, she cried. She cried her lungs out after that. We had to stop the recording and stuff. That's how it was. Imagine the doctors telling you that your kid would live only a month, and that kid is the solo kid, that you have. The Indian parents can understand the pain, because having just a solo kid for them is something different. Right? So that's what makes us different from the doctors. We don't give them negative energy. We give them the positive energy as healers, right? That's what they say, that, the kid is going to live 1 month, right? That is the negative energy. People don't like that. People don't like that. What people like is the hope and the positivity, right? That's what I did, Radu, isn't it?
Yeah.
Nothing else. I didn't do anything differently.
Actually, coming back to the parents and the kid, after they saw you, and they were telling me they were very impressed by your presence, and yeah, that was the optimism and the energy that you gave. That's for sure. This was the biggest impression. They didn't know very well English. They just know a few words.
They
So
didn't even understand probably my language. I don't think they would understand English that much, you know, because
Yeah.
Radu had to translate it, isn't it?
Yeah, exactly. It was the something, it was the energy of hope that things could go in a good direction, not just stagnating there or degenerating.
Exactly. Right. So that's what we need as a healer. Right. That's what the patients, that's what the clients they need.
Yeah.
A hope, the positivity, the energy, right?
You know, one
The
day,
smile.
yeah,
Yes.
I remember once a client told me, why you are telling me, why you are so sure that I'm going to heal and I'm going to be, you are lying to me. You are giving me false hope. Why you have to, can be so certain about that? And I realized that in that moment, what was happening, and when I said to her is, I'm not lying you. I'm not saying something false just because to give you false hope. But what I feel and what I connect is with one part of you that I can feel is health, is already health. And I can feel
Exactly.
it. And I can feel your energy there, and I can feel you there, and you can go there. And what I do is my invitation. If I can feel it and I can see it, I invite you to go there. And if you follow the instructions, you can go there. But obviously, if you don't follow that path, you can find different thing. But I'm not lying you. I can feel that and I can see that in you, you know. Then is something that I think is important, because sometimes we think like we are just giving hope because it's good. No, it's important to feel it. It's important
It
to
is
feel
important.
that that person has a vital energy and has the possibility, the version of itself to be healed completely. And that version of ourselves is always there. And we can connect with that version.
Beautiful.
And if you feel it, and you feel that person in that version of himself being alive and being health and being I feel it from their heart. And if I feel that, I'm so sure I can tell them, you can cure yourself. Of course you, because I feel you. I feel, yeah. I don't feel, for example, I never feel my clients ill. I never, ever. Because if I put much attention in their illnesses and in their, I got down, you know. I know, I always listen with attention and with mind, cold mind, all the details, but at the same time, my emotion is going through the version of the heart of the person, and the heart of the person is always full of life and full of health and full of everything. And that is what helped me to give them hope, because I feel it, absolutely feel it. And my
Fantastic.
invitation is to tell them, go that way, and you have to do these things and you can go that way. And
Fantastic. Yes. Thank you for sharing, Pilar. Right? You're such an amazing healer. Right.
I try.
Right. You've been helping so many Spaniards. Always. Thank you. Thank you.
You're welcome. You're welcome.
Yes, Radu, would you like to ask a question? I see that you have raised your hand for
Yeah,
quite some time. Sorry.
Coming back to the goat milk. There is a person that I have in the treatment. Maybe we were speaking a little bit about her. She has a very high pitta, and she has problem in her, like a very, not now it's happening. 1 year was just improving, but now it's back to some problems with her intestine, and have sharp pain in the intestine area after having the motions,
Mhm.
especially when she has the second or the third motion, because she has about 2 or 3 in a day.
Okay.
So now the goat milk would do the thing for this case.
Looks to me more like inflammation of the intestine rather than a liver inflammation there. So I would rather say, avoiding dairy on the whole would be a good thing,
She do
right?
this.
Because
Yeah.
it would create ama, and the ama would make the things even more worse.
She don't eat any dairy or
Yeah, but goat milk
any,
would mean a dairy as well.
no,
So
not even goat milk. Not even
not
goat.
even goat milk. Yeah.
No, she's not
The
not
best the
eating
best
anything.
condition to use goat milk would be someone with a liver problem, or someone with ascites, someone with
Understand.
fluids.
Okay.
Yeah. Where they are told by the doctor to drink less water because they are accumulating the water inside the belly. That's when you
All
can.
right.
Yeah, that's a good condition to have goat milk. Anything with intestines or colon, I would say we have to do gluten free and dairy free, because it can create more inflammation of the intestines or the colon, and then it can make the things worse actually. Toxigo is something that can help there, right? Toxigo, maybe Pitta, right? Because here, Pitta has actually gone out of its place, right? So, as per the stages of disease manifestation, this is like a stage 5 or stage 6, if you know what I mean, right? Yeah. So it has gone from its seat, which is either liver or intestine or stomach. It has moved to the area which is a vata area. In case of colitis or the Crohn's or ulcerative colitis or something like that, Pitta has moved from its seat to another place. And that's when you use something stronger, which helps to calm down the excess pitta there, which is pitta shamak or chandrika ras.
Does Rakta Bandha work with these cases?
If
Or because
there is bleeding, like I showed about Adrian Christie, there was bleeding because the platelets were really depleted to begin with. The platelets were less, so the bleeding wouldn't stop actually. So we had to do Rakta Bandha for a few years to control the bleeding. Yeah, those are some of the conditions where you can use Rakta Bandha. And for example, in case of ulcerative colitis, where there is occult blood in the stool, right? That's when you can use it. But if there's no blood, it's okay if you don't want to use Rakta Bandha.
Okay, so I'm just why I'm asking, because I had with me some Rakta Bandha, and I have to give something to her for the Pitta, which I don't have the pita shama, so I just gave her this, knowing that it's calming pita, but I didn't really know if there is a precisely good for the colon. And I just say, okay, is it pita decreasing? Then
Mhm.
just take it for.
Thank you. Thank you.
Yeah, thank you very much. Thank you.
Thank you. Yes. Yes, Anna.
Hi, Dr. Ronak. So about the Luis, the patient you have done the consultation with, he started the hormonal pills, and then now he has the injection hormonal thing.
As well. Okay.
Yes, and he sent me a message that his hemorrhoids are worst. So one question is, can the injection hormones provoke hemorrhoids high aggravation? How can you talk a little bit about that?
That can happen sometimes, yes, because of the pills, the hormonal pills and the injections that he has been taking.
Okay.
It can sometimes create inflammation, but it would subside. It would
Okay.
subside in a few days.
And can we help with something specific for the hemorrhoids?
So for the hemorrhoids, what I would say is, if it's really painful, he can take a big, tub sort of thing where you put warm water and a little bit of alum.
Alum? What is alum?
A-L-U-M, alum.
Alum.
Hello.
Is it a potassium?
Hydroxide or something. K-A-O-H. O-H
I
or
think
something?
yes.
I think so.
KOH. Yeah.
K-A-O-H.
Okay.
So you put just a couple of teaspoons of that thing in the water, and you foment the place, by sitting inside. Yeah,
Okay. Okay.
that can help reducing the inflammation of the hemorrhoid.
Okay.
And if there is also a little bit of bleeding, this can help to stop the bleeding.
Okay.
The thing is, alum is a very good natural antibacterial. So it helps to reduce the infection, if any.
Okay. Mhm. Okay, so cumins, the herbs usually in the food, cumins and so on, no problem.
Cumin is cooling, so there's
Yes,
no problem.
it's okay.
No
He
problem.
can
It's
continue
okay.
with everything. He's pita, so he's not taking nothing for, yes.
No. I would be a little bit careful with dry ginger, though.
Yes, ginger, yes. Mhm. Okay.
What is the maximum internal intake of alum if you take it with the
Internal?
Yeah, internal.
I mean, so you have to be careful when you give alum internal, because country-wise, I guess the rules and regulations are different. I guess I don't know if that's allowed in some of the countries, right? But in Ayurveda, they say pinches. So you take, pinch, like a few pinch, like 3-4 pinches a day. It's also a very good home remedy. Along with the CCF, you mix alum and then you boil it and take it for people with continuous bleeding. Like, for some women, the bleeding wouldn't stop for days and days. It would go on and on and on. There, This is one of the good home remedies, alum with the CCF. Boil it and take it. But you have to be careful because countrywide, I don't know if this thing is allowed, the country-specific laws and stuff.
We are fine. We
Yeah,
are fine. I took it. I just didn't know exactly the
yeah.
maximum dose or something.
Yeah.
Talking about hormone.
Just a minute, yeah.
Yeah.
Anna, you reminded me of a good case study. Maybe next time or subsequent calls, maybe we will speak more about one of the cases that I treated in Syracuse, who had similar condition.
The one that you told?
Yeah.
Okay.
Right. I will gather the information. If I get any of the reports or something, I'll check with him. There's also another student in PAT whose father I treated in US. He also had stage 4 liver cancer, and he's a survivor. So he's completely out of it. Of course, we did chemo and both together, Ayurveda, but you know, there are so many people that couldn't survive, and he is 75 and he's still going strong. He goes, you know, to the woods to chop the woods. Right. We will talk about it next time or any of the subsequent classes for sure. Yeah.
Okay.
Sorry about that, Pilar. Yeah.
No, just talking about hormones. I've got a person that she got the operation that is when they take off all the ovaries and utero, everything out. And she is asking me, what is happening then with my feminine hormones? And it's a good question because now she hasn't got any estrogens, estrogenos, and no. And I suppose I don't know if I'm correct. Something like suprarenal is doing the kind of job or not? Or who is doing the job?
Yes, just a little bit.
How we can Ayurveda can help to women that with that kind of condition that they don't have any ovaries and utero, because it's difficult because now she's going to, I suppose, going to have asti problems with the bones and with the astidatus and vata as
Right.
well,
So
and skin and everything.
yes,
No?
yes, and that's what makes Ayurveda you know, great, because we not only you know, focus on treating the ailments but also preventive, right? So you can always give the home remedies, you know, to boost the calcium. The home remedies with broccoli and almonds and the calcium supplements, you know, which can boost the calcium naturally, right? And if somebody is really interested in preventive, we can advise them to take Sandikal, Pain Mukti Sandikal, right? Also, Meta Boost is something that can be given, or Kumari Yoga, depending on how you feel is the situation.
She's going to go to Dr. Heman, but I think he's nearly convinced to go. But for that reason, I asking you, because then I can be more certain that we can help her to.
Of course, we can help. We can, yes. We have helped people with osteoporosis, osteopenias, you know, yeah, we can help. We can help prevent it, and we can help people with even osteoporosis. Yeah.
Mm-hmm. And what happened with the feminine hormones? How the body produced when there is not ovaries?
So yes, like you said, the suprarenal glands they produce just a little bit of the gonadotrophin, they call it. So they produce just a little bit, but then with the age, people would go in menopause.
Sorry, the connection is gone.
Yeah.
You frozen, Dr. Ronak.
Oh, just a minute.
You coming back, I think. No.
Yeah.
We cannot see you. Can you hear us?
Yes.
Dr. Ronak?
He's gone. Oh,
Yeah.
he's there.
He's gone for now. I don't know. Just give him a few minutes.
You there?
Yeah.
Nah, here we are.
Yeah.
Yes.
Something with Zoom. Now, what happened actually? Right. So what I was saying is, with the age, sometimes some people would go in menopause, isn't it? And that's when the body stops producing some of the hormones, right? So for people like this, they would go into a premature menopause, maybe, right? If they show the symptoms with hot flashes and the other stuff, if they need help, we can give some of the supplements that we have, Kumari Yoga and Sri Sanjivani, Chandrika Ras. These are some of the things that can help, right? But if needed, you can give Sri Sanjivani for the estrogen support. Otherwise, you can advise Kumari Yoga, which helps with the general hormonal imbalance post surgery.
Kumayo.
Kumari Yoga.
Kumayo.
Kumari Yoga helps to reduce also the inflammation, post the surgery. Like what happens is a pelvis is the vata area, right? So when you have this kind of surgeries, it leaves the space hollow, and vata likes to move around, right? Because it got the space that it craves for.
And then Vata is happy because got more space, or what?
Yes, vata got more space, so it is happy. It gets what vata craves for, right? Like the sugar. We all crave for sugar, isn't it?
Okay, then maybe Dr. Ronak, that kind of people has less possibility to get dementia because vata energy doesn't go up because they've got more space down, or it's nothing to do?
It doesn't have to be like that always. Doesn't have to be like that. It doesn't have to be like that, because vata doesn't work like that.
Yeah.
It's very unpredictable.
Yeah, it's true. It's true.
Vata is unpredictable.
It's true. Yeah. I see from my mother. All vata is in her brain. And it's unpredictable. Even 90 years old could be a child with very strong energy and create a storm around, or can be very calm and very very unpredictable. Yeah, it's true.
Very
It's true.
unpredictable. Yes.
I
So,
don't know.
any more question? Yes. Yes, Radu.
Yeah, I don't know how it's in the other countries, but here what I notice, maybe 90% of women have problems after 40, starting with the 40s and going up, and many of them doing hysterectomia. It's unbelievable. Even in monastery, they have huge problems, huge problems. Women there. It's unbelievable how unbalanced is human being today. Unbelievable.
True. True. It's all um, the lifestyle, the food habits, and the habits, and everything. You know, that we've been doing. Yeah. Also, the protocols differs from country to country, I guess.
Yeah.
So,
It's probably another thing.
yeah, great. But I loved it. So many questions, interesting questions.
What about your study case you told us about the young man? What is the future for him?
So the future, as the father told me, is that they are going to try to apply another visa for him to get back to Canada.
The
He
one
wants to
fact-
go. He wants to go back to Canada, and that's what I've heard from him.
Oh,
Right, I can tell you a little bit more once they visit, probably on 10th of March or something. But at the
okay.
moment, he's doing pretty good, and yeah, he wants to go back to Canada because that's where he was born. Probably the kid has Canadian passport. I don't know. He wants to get back, and to begin with, we told him that up until 6 years or 7 years, it's better to live with the parents here in India, and then they can think about something. So
Okay.
for now, he's going with the grandparents. The father cannot go because he doesn't have the passport, the Canadian passport. He has to apply for the visa.
Okay.
So
But he will
that's
be
how they
fine,
do it.
yes?
He would be fine. He just have to follow the gluten-free vegan diet probably for the rest of his life.
For the rest of his life, yes. Okay.
Yes, because the liver, he has a genetic condition. Of course, we have healed it, but we don't want, something to happen, isn't
Yeah.
it? Life is very long.
That's true. That's true. That's good. That's good.
Yes, thank you.
Thank you, Dr. Ronak.
Thank you. Yes, Niharika.
Yes, Radu, did you mention something about speech marma for the child who had that autism? Or did I hear wrong?
Yes. Dr. Ronak could explain better about that because I learned from doctors of Shakti. So
Okay. Just give me a minute. Let me show you a trick, maybe. It's easier to understand that way. How to do this speech marma. Right, so it's here below the larynx with the 3 fingers. Where is it? I didn't send you the picture, isn't it? Yes, I didn't send you the picture with the email, Radu. No, right?
For that, I don't think so.
Mhm. Yeah, I got it. There you go. So this is the speech marker. So you take the 3 fingers and from the bottom of the larynx, you stroke it upwards.
Right. How do you do like 6 times?
You can do
Yes.
it. Yeah,
Mhm.
you can do it many times. Yeah, 6 times and 6 times
Good.
as usual.
So is the 3 fingers in the horizontal and we push a little bit up?
Yes, you stroke it upwards to the chin from here.
Okay.
To the chin.
Like bringing the
Udanavata
out. Yes.
Yes,
Bringing
exactly.
the speech. Okay.
Yes, right.
Like
So
that way.
with
Yeah.
people who has speech problems, it's most of the times there's a blockage of Udanavata by kapha. Most of the times it's a kapha blockage or ama blockage to the Udanavata.
Why by kapha?
Because kapha, this is the area.
Ah, okay.
Right? Nothing complicated.
Okay.
Simple.
Can I
Even
ask
the
one more
people, the
question?
tortured people that speak like that are as well, that
As
go
well.
with that.
As
As
well,
well.
people with stammering, people who doesn't have a clear speech, you can do the murmur because it is also a partial blockage, isn't it? A partial blockage of Udanavata.
Can I ask one more question?
Sure.
It's about Brahmi. Brahmi powder, it says Gotukola. But here, if I go and buy Brahmi, it says Pacopamin Monieri. Is it the same thing? No. Is it?
Well, so there are 2 types or several different types, I would say, different species, right? Bacopa monieri is one of the major species that they use for medicinal purposes. There's another one which is Centella asiatica, which is also a type of Brahmi, right? They use it also. There's Herpestres moniera, which is one of the other species with a similar family, right? So there are different species, yes. Gotukola is also one of the species that you can use.
Same effects.
Similar effects.
Very good. Thank you.
They have, I mean, one is better than the other, but yes, they have similar effects. Yeah, similar effects. Yeah.
Good. Great. Thanks.
Yet about the speech marma, if the person needs to do to his or herself, how is the best way? Because the 3 days.
Yes, you can't do it like that. It has to be like that. It's a
difficult.
little difficult. It's a little difficult. When you do it for someone, it's easier.
If we do for ourselves, we can do like that.
You
Or
can
bend your
try.
fingers. Bend your fingers and use your knuckles like this.
Like that?
Right. I have never
So
tried it like that. right? But yes, this, when you do it like this, because the position of your I mean the fingertips, in a way, it stimulates the larynx, you know, and the
For singing,
windpipe
for singing also it's good.
also. Yeah.
That's why I'm thinking, how can I do it?
Right. You can try, or you can get a help from someone, maybe.
Okay, I'm gonna try. Thank you.
Yeah. So, any more questions?
Yes, I
I
want
loved
one.
it. It was nice. So
Sorry,
many questions.
I don't want to keep
Yes.
much space, but
I know.
I've got a friend, two friends of mine has a child that he was adopted, and they realized that was Asperger's. Asperger's? I don't know in English. Elsa, Asperger's?
Yeah, I think it's Asperger's.
A kind of autism.
Asperger's syndrome.
Yes, Asperger's. Yes, Asperger's symptoms.
Similar to autism. Yeah.
Yes,
Spectrum.
and I've got a theory that not everyone, but the most of Asperger's and even autism is due to vaccination. And in this case, it's quite clear because the child came from Peru to Spain, and because they never got any vaccination, the doctors thought that it was very good to give him like a 10 or 11 vaccines altogether. Can you imagine?
Right. I can imagine.
What kind of decision? And what I realized, because I knew a big group of fathers with problems with vaccines and autism, is related to intestine, that they create a lot parasites, parasitos in
Yeah.
and it's very related to Ayurveda, because what Ayurveda said is that when Vata, the intestine is dirty, Vata goes.
Yes.
Vata wants very clean house, and when the house is not clean, is what I think. Vata say, "This is not clean, I go."
That's a beautiful analogy.
Is what I feel it. No.
No, it's a beautiful analogy. Yes, that's
And
good.
then,
Yes.
for that, when the Vata goes out of the house and goes here, and we got so many children with hyperactive, and it's like children hyperactive, is very similar to my mom. That is dementia, but it's not dementia that they forget things, but it's something that they cannot
I understand.
stay
Yes.
still. It's like you can feel the earth in their brain, like my mother living with her. I feel the energy in her brain that even 98 years old, she can't stop walking and going and going and going, because it's the brain, it's the air in the brain that is doing. And I think hyperactive children is the same, because I remember why one children that was crying, saying, "My mom shouted at me to stay still, but I want to do it, but I can't. She thinks that I don't want to. I want to still, but I can't." And I think it's the same as my mom. My mom wants to stay still, but she can't. And I think it's better. And my question is, do you think could be that relations with the vaccines and create all stuff in the intestine and causing Asperger's and autism? Do you think it's quite related?
That can be one of the explanations, maybe. Yes. And I also have observed at times that this kind of issues, they also come from psychological trauma.
Uh-huh.
Deep psychological trauma suffered in the childhood. Like you said, the kid came from Peru to Spain and he was adopted.
And he was
which-
abandoned. He was
Yes,
abandoned.
which makes a possibility of some kind of trauma there. So that's another thing.
Please,
that
I want to share with all of you. How can I get what is the trauma of my mom that I see very clearly that she can keep quiet, I can manage to her, but as soon as it's getting dark, forget it. Until 4 in the morning or 5 in the morning, that is when it's starting the light again. And I think it is something that happened to her when she was a child at that certain time, because even before my mom was with dementia, even before when I was a child, as soon as getting dark and we were in the street, my mom always said, come on, we have to go home, we have to go home. My mom didn't like ever the night, you know. And now, since I 6 years with her, and I see very clear her dementia, and the pattern is so clear, and even when it gets older, it's more clear and more clear and more clear. As soon as it gets dark, now the lady who is looking after for hours from 4:30 to 8:30 is incredible. As soon as it gets dark, your mom is impossible to manage. It's walking and walking and walking, getting nerve. This one.
I make the experience that my mom was teaching me like Baba Yaga. This is like a bad grandmother who is knocking in the darkness on the door.
The bad man?
A bad grandmother, yeah. And if I'm not listening to her, she's calling me, Baba Yaga is coming and knocking on someone's door. And I was afraid of the darkness because of this reason. But after I overcome the darkness by myself, yeah, I'm get more comfortable in the darkness.
Yeah. So the Marma points, the lovely Marma points, that can help you get over it.
Even if I don't know what he needs to forgive and forget, even if she is not a conscious, because she's not conscious of anything. Yes, I'm doing this. And that's it.
That one, and the anxiety ones, also the head ones.
All the 5.
Yes, all the 5.
And this one. And I thought I was doing the 6 point in the arm for trauma and emotional, but it's not getting very good, actually.
Persistence. Persistence, right? Sometimes you have to do it a little longer, right? Since the trauma probably is from the childhood, the fact that she is 90, something has been there for ages, you know, it wouldn't go so easily.
Then this one and
David,
this one.
Because he's young and it's not that old, you know, he could get over it quicker.
Yeah.
And with your mother's special condition with the Majadatu, it's a little different.
I have to say that she is improving a lot. He's sleeping through the remedy, the home remedy, that is the almond milk with the
nutmeg,
saffron.
Yeah, the nutmeg and the saffron.
Yeah, I do every night, and I do it the 5 marmas, all the marmas, and sometimes, not always, I have to say, sorry, not every day, but sometimes I do all the procedure of the belly button of ghee, and feet and this and this. And I have to say that now at least she's sleeping all one go from 4 in the morning to 11. That is a lot. She never did that.
That's
But
great.
still, yeah,
That's great.
that is amazing. It's amazing, amazing. One go, you know, sometimes it's 4:30 or 5. And but I have to lie to her and say, Mom, it's 6 in the morning. And that for her is like is sunset, you know,
Yeah.
sunrise, because she doesn't see anything. Then if she feels that is the night is gone, she rest. And then sometimes I said to her, even if it's 4, say, Mom, it's 6 in the morning, please, you have to sleep. And then from 4:30 or 5 till she's improving that. But I suppose, as you said that of the trauma, I suppose that she can sleep normally until 4 because of the trauma, because of the...
Yes. You have to go deeper and find out.
Yeah. Wow. Okay, I'll let you know if I can find out what it is.
Well, all the way best. Yeah, buona sorte.
And then this child, I share with you that the vaccines and etc. Asperger's, he's 20 years old. Do you think I can advise to their parents to go to consultation, a Shakti consultation for that?
Sure.
Even if he's 20 years old, we can help him.
Absolutely. Absolutely. Right. There's a video on YouTube on iShakti channel. If you look for it, Dr. Ram helped someone who was 21 years old with the autism.
Wow.
So yeah, we can help even at that age.
Can you maybe just write down Dr. Naram autism? I can find the video.
Yeah.
Because that would be good if the parents see the video and the results in one case. Maybe it's a good stimulation for them to take the... Because it's a pity. He is very intelligent, and but he's stuck in that, and he cannot progress in anything because he got, for example, now he went to a job because he do a course about gardening. He did the course, and then they got a job, practicing the job, and they put it out of the job. And it's so traumatic for him. And the parents now is in court because they are doing that to him. But, you know, it's a pity because he's very clever and very, but for his condition, you know, people can manage this kind of people with this condition, and as soon as they are special, they throw them away, and then the life for them is very difficult, very, very difficult.
I understand.
So you can put the link of the video in the group, because I would love also to see, please.
We'll check that for sure. Yeah.
And if I find it, I put it as well.
Yeah.
Thank you. That will be wonderful, wonderful. Thank you
very much. Thank you. Right. That was one hell of a session. I loved it.
Dr. Ronak.
Right. Everybody participating. Fantastic.
Thank you very much, Dr. Ronak.
Thank you. Thank you.
Thank you,
it's always
David.
a pleasure meeting.
Thank you, David, to show me your cure, because give me stimulation to do the same with my mom.
Yes.
You know, we don't understand the power sometimes of sharing, but really help me to give me hope.
Yeah.
Thank you very much. Thank
You're
you.
welcome.
Great. Right. That's what you have to do as a healer. Right?
Yes.
That's a good start, David. Sharing your own experience. Yeah.
Yeah,
I
beautiful.
got a lot. Yes.
Powerful. Yes. Thank you. Thank you. Right. So
Thank
shall
you.
we go back to the main room now
Yes.
and see how many people are still there?
If somebody is there.
If somebody is there. Right.
Well, I will stop the recording then when
Sure.
we are finished. Yes? Here.
Yeah.
Okay.